So you've probably heard that cataract surgery is around 98% successful. And this sounds pretty awesome, almost like a guarantee, right? Well, here's the blunt truth. What really happens in that other 2%? And what does successful really mean? My name is Dr. John Legaretta, and I'm a board-certified ophthalmologist and cataract surgeon. Every patient quietly wonders, will I be the one who doesn't see clearly afterwards? In today's video, I'm going to cut through the marketing and the myths. You'll learn what doctors actually mean when they talk about cataract surgery success, why patient expectations sometimes clash with medical reality, and what you can do to protect your vision before surgery. So there's no sugarcoating, no fluff, just facts you can rely on. What success actually means in cataract surgery. I want to start with a medical definition of success. In the surgical world, a cataract procedure is successful when the cloudy lens is cleanly removed, the artificial lens sits securely in the right position, and there are no structural or infectious complications inside the eye. In other words, the operation went as planned, the anatomy looks perfect, and the eye remains intact. And that's what drives that 98% figure. But that isn't necessarily the same thing that most patients call success. And so when you think about success, you're probably picturing waking up with sharp vision, no glasses, and a clear, crisp world that same afternoon. And this gap between what's medically perfect or correct and what feels perfect to the patient can be wider than what people expect. So the truth is, perfect surgery does not always mean perfect vision, at least not initially or immediately right after surgery. So for example, mild blurriness, some glare, or even halos around lights in the first few days are totally common after surgery. Your eye has just been operated on. It's a little irritated and swollen. The cornea may still be adjusting, and your pupils may still be reacting to the dilating drops. These temporary vision changes don't mean the surgery failed. They're just part of recovery. And then there's the issue of adaptation. The brain and eye operate as a team. When the cloudy cataract lens is replaced with an artificial one, color contrast, depth, and light sensitivity all change. The brain needs time, sometimes weeks, sometimes months, to recalibrate. So while most patients can see clearly within a few days, true visual comfort evolves gradually. And finally, lens choice influences what success looks like. A monofocal lens gives you crisp focus at one distance, while reading glasses handle the rest. While a multifocal lens can give you a wider range of vision, but may come with some glare or halos, especially driving at night. Neither choice is wrong. They're trade-offs. Once you understand these realities, that 98% statistic starts to make real sense. The surgery works, but satisfaction depends on alignment between medical success and personal expectation. And now that you understand what counts as success on paper, let's talk about what really determines your outcome, the real factors that determine your outcome. So this is where the story gets personal. Even the best cataract surgeon using the most advanced lasers and phacoemulsification technology can't override how each eye started out. Biggest determinant of your final result is the overall health of your eye, not just how cleanly the cataract comes out. So for instance, if you have diabetic retinopathy or macular degeneration or even glaucoma, these conditions can affect the retina or optic nerve. These are tissues that actually translate into sight. The surgeon can replace a cloudy lens, but they can't fix the damage behind it. So when I say 98% of cataract surgeries are technically successful, remember that number reflects the procedure itself, not the total visual potential. And some eyes simply have a lower ceiling for clarity. The type of lens you choose also matters a great deal. As discussed before, a monofocal lens is simple, precise, and provides excellent image quality for one focal point, near or far. It's really the most predictable option, especially for people with pre-existing eye disease. Multifocal lenses or extended depth of focus lenses promise freedom from glasses or more freedom from glasses, but that convenience comes at the cost of some optical compromises. And some patients will experience halos, glare, or even reduced contrast sensitivity, particularly when driving at night. These effects often fade as the brain adapts, but they can persist. And knowing this up front prevents disappointment later on, especially after surgery. Next, I want to address the human factor, your surgeon and their equipment. Cataract surgery techniques are highly standardized today, but small differences still matter. Consistency, surgical volume, and access to modern tools like femtosecond lasers and advanced phaco emulsification systems can subtly improve patient outcomes. However, the best technology in the world won't help if the basics of preoperative measurements, lid hygiene, and follow-up appointments aren't meticulous. Choose a surgeon, not the device. Look for experience, attention to detail, and willingness to explain your choices, not just selling you an upgrade. And now here's the uncomfortable part many people overlook. Your own habits do play a role too. Following your postoperative instructions sounds very simple, but skipping them, skipping a drop, or not following some of the instructions is one of the fastest ways to slow your recovery. Using your prescribed eye drops exactly as directed controls inflammation and really can help prevent eye infection. Rubbing your eye, ignoring protective eye shields, or stopping drops early can invite problems. Most of the minor complications that appear in the 2% group trace back to incomplete compliance. Your job is to give your eye an environment where healing can unfold cleanly. And when someone does land in that 2% category, it's not always a major setback. Beyond the mechanics, emotional recovery also plays a role. Many patients underestimate how much anxiety and expectation shape perception. If you expect perfect clarity on day one, any residual blur feels like a failure. But if you know that the eye is still adapting and subtle vision changes are normal, you'll interpret those same symptoms as progress. The truth is, most patients who feel disappointed right after surgery feel differently 2 or 3 weeks later once the healing settles in. Age, lifestyle, and even the general health of your tear film matter too. A dry ocular surface can scatter light and make sharp vision look soft, especially after surgery. So treating dryness before surgery improves both your comfort and the accuracy of your pre-surgical measurements that help guide your lens selection. So if your tear film is unstable, those measurements can be slightly off, and so can your result. And so these small details like this can explain why one person will rave about their cataract surgery experience and another quietly feels underwhelmed. Every one of these factors, your baseline eye health, your lens choice, your surgeon's approach, your aftercare, and your mindset interact. There's no single ingredient for success. It's a partnership between surgical precision and biological healing. And the good news is that almost all issues are predictable and with preparation avoidable. So when you hear that cataract surgery has a 98% success rate, take comfort in it, but also understand its nuance. The statistics prove that the operation really is extraordinarily safe and effective, but your own satisfaction hinges on context. The healthier your eyes, the more realistic your expectations, and the more consistently you follow instructions, the closer you'll come to that perfect vision experience you're hoping for. And now that you know what influences results, in the next section, I'll look at how to stack the odds even further in your favor. How to stack the odds in your favor. Now that you understand what drives a good or disappointing outcome, I want to talk about how to actively tilt things your way. Success in cataract surgery is rarely about one brilliant moment in the operating room. It's about 100 small, careful steps building up to it. Start with your consultation. Ask direct, specific questions. How many cataract cases has your surgeon performed? What's their personal complication rate? Do they routinely implant the lens you're considering, or is it something new to their practice? Experience doesn't just breed confidence, it lowers the chance of surprises. Also ask about their aftercare plan. A detailed follow-up schedule signals a surgeon who's invested in your long-term result, not just the surgery day. And next, optimize your overall health before the procedure. So if you're a diabetic, aim for stable blood sugar levels, because fluctuating glucose levels affects your cornea and can blur postoperative vision. If you have hypertension, get it controlled. High blood pressure increases the risk of small bleeds during surgery. Dry eye disease should also be treated before the operation, because a stable tear film improves measurement accuracy as well as comfort afterwards. And you got to think of this as tuning the instrument before the performance. Then comes the conversation about lens type and your personal goals. Your neighbor's glasses-free outcome may not match your specific visual lifestyle. Monofocal lenses offer unmatched clarity, but at a single focal point, while a multifocal or extended depth of lens offer more range, but that trade-off can be a bit of decreased contrast sensitivity or issues with night vision. So if you drive at night regularly or you do detailed work, a simpler lens plus light readers may serve you far better than chasing total freedom from your glasses. But you need to discuss this with your surgeon. And the blunt truth is this: a lens that fits your life beats the one that sounds most high-tech. Self-readiness matters too. Patients who feel impatient, uncertain, or burdened by unrealistic expectations often struggle the most during recovery. If you're not yet comfortable what surgery can and cannot achieve, pause and keep asking questions. You need a calm mind going into the procedure. And likewise, if any chronic eye conditions like diabetes or glaucoma are unstable, you're better off delaying until you're under control. But again, you need to discuss these decisions with your cataract surgeon. Cataract surgery is elective. There's no prize for speed. After the operation, follow the instructions with precision. Use every prescribed drop exactly as timed. Wear your protective eye shield when sleeping, and avoid bending or rubbing for the first several days. I know this sounds tedious, but this discipline turns a good recovery into an exceptional one. And so most setbacks happen when patients assume the eye looks fine and I'm going to stop my drops today. You got to give it time. Healing is biological, not negotiable. So in conclusion, cataract surgery succeeds in roughly 98% of patients, but true success isn't just about the statistic. It's you waking up to vision that matches your expectations and supports your daily life. The smoother the preparation and the steadier your aftercare, the better the outcome feels. So if you're considering cataract surgery, take this as your roadmap. Ask your focused questions, stabilize your health, be patient with healing, and respect that every eye is truly unique. Do that and you'll almost certainly fall inside that trusted majority who see beautifully after recovery. For more straight talk about protecting your eyesight, subscribe to Eye Health Central. I try to cut through the hype, answer the hard questions doctors often rush through, and help you stay truly informed. Please give this video a thumbs up and share with anyone thinking about cataract surgery. And also drop your questions or experiences in the comments below. I read them all and use them to help plan future videos. Stay proactive, stay realistic, and take care of your vision.